Close your eyes.
5-year-old Violet Opazzo is getting her second coat of sunscreen. She's not allowed outside without it. That wasn't the case when Mom Taylor was growing up.
Thank you.
She remembers spending hours by the pool without any sunscreen, soaking up the sun's rays. But today,
I don't sunbathe at all. I love being outside and I love working in the garden, but I just can't go hang out at the pool all day in the water or without any protection at all because I'm afraid.
Afraid that she might get skin cancer again. During a routine examination, Taylor's dermatologist noticed a suspicious blemish near her hairline. After a biopsy, the lesion was found to be a superficial cancer not unlike Basil cell, the most common form of benign skin cancer. The second most common skin cancer is squamous. While neither is deadly, they should not be ignored.
The majority of skin cancers occur in sun-exposed areas, and these skin cancers are less likely to be fatal than malignant melanoma, which can be anywhere. But they do occur on areas where people have gotten the most sun, and they can be locally destructive.
Taylor opted to have her spot removed using an outpatient technique known as Mohs micrographic surgery.
Of course, the biggest advantage overall is that it is the highest cure rate available.
Since her surgery, Taylor keeps a close eye on her skin, knowing she has about a 50% chance of a recurrence.
My makeup has sunscreen in it. Even if I'm out for 10 minutes at lunch, then I'm not worried about burning my face.
Basil cell and squamous are both slow-growing, but will continue to expand until they're treated.
Let's start out by looking at your back.
Self-detection is not always reliable, so a yearly visit to a dermatologist who can check for skin abnormalities is advised. But for melanoma, the most serious and fast-moving form of skin cancer, time is of the essence. Dermatologists have developed a simple acronym, the ABCDE method, to help you determine if a mole on your skin should be immediately examined by a doctor. A stands for asymmetry.
Asymmetry meaning if your mole, one half looks different than the other half, it's an asymmetric mole and there's a risk. Border, if the border of the mole is blurred. Color, if there's more than just brown, if there's blue or black or red. And diameter, if it's a large mole, say more than a half an inch to an inch in size.
And E is for evolving, as when a mole or skin lesion changes in size, shape, or color. Those most vulnerable will have fair skin and blue eyes, have had multiple and repeated sunburns, or a family history of skin cancer.
You never know. A little mole could be something that could kill you.
If you're in a high-risk group, you should limit sun exposure and examine your skin once a month with a mirror. For WebMD, I'm Damon Maharg.